Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined by Dallan Huff, the president at Motient. Dallan, how are you today?
I'm doing well. How are you doing, Jared?
I'm doing well. Excited for us to chat. We usually like to dive right into this, so let's start out with a little bit about your background, and then we'll talk more about Motient.
Yeah, absolutely. I've worked in healthcare my entire career. I started almost 20 years ago as an on-call housekeeper at a hospital at night. I'd go in and clean the rooms once a patient was discharged, and uh, moved into uh, moved into managing the housekeeping on the night shift while I was in college, and after that worked for a large health system for a number of years, moved into the medical device space for a little bit before finally settling into the healthcare IT arena. And that's where the bulk of my experience working with 3M Health Information Systems um, for about 8 years. And then most recently with Air Methods, one of the largest air medical providers, and then now as president of Motient.
And let's tie that back into which usually it always does in some way. I always ask about the company for whichever guest comes on. Give us the why, how, what of Motient. And usually that why always plays some, there's always, not always, but like more often than not, there's a tie between like your background and what really resonated with you being in the role, right? So can you give us the why, how, what of Motient? And then we'll go into some of the core topics we want to discuss here today.
Yeah, absolutely. So, we're a patient movement platform. We're focused primarily on emergent interfacility transport. So, we're all about helping make sure that patients are getting from the to the right facility by the right mode of transportation, so that they're receiving the best care possible en route, but also making sure that they're getting to the right destination that can care for them and care for the condition that they have. We were born out of our two founders were emergency department physicians. That were really looking at what they had to do on a daily basis of moving patients from one hospital to another, and really decided that there had to be a better way to decide which mode of transport that patient should take. So whether they should go by a ground ambulance or by an air ambulance, they saw a lot of variability across the board, and really wanted to help to standardize and organize that decision making process. From that, we expanded into a more robust platform that not only helps with that initial requesting process and decision making around what mode of transport is the right mode, but also bringing together that sending facility, the receiving facility, and the transport vendor into a single platform where they can communicate and everybody can understand what's happening with that patient as they're moving. And then all of the inputs that go into that make for really robust data on the back end that helps you to understand how patients are moving within a system, whether that's a system of affiliated hospitals, a system of unaffiliated hospitals, or in the state of or in the case of our largest customer, the state of Kansas, how patients are moving in an entire state. So, go ahead. Sorry.
No, no, you're fine. Keep going if you want
Yeah.
to add to it.
We do this through a software as a service application. We're entirely web based. We back that up. We have customers that use a 24/7 communication center that we have as a support for that SaaS application. We also have customers that are uh, using the software within their own transfer centers. So we really have a couple of different models that we use, but at its core, uh, what we're all about is making sure that patients get to the right destination via the right mode of transport, so that we can be as efficient as possible within the system, but also focus on the quality of care that the patient's receiving.
And One of the big questions that you and I wanted to discuss here today, and we can relate it back to Motient, but first, kind of give us the overview of what you're seeing. But what are some of the issues around patient movement, like that have been caused basically, or that COVID-19, this pandemic, has highlighted? Let's say that.
Yeah, so I think it's different for different types of hospitals. One of our core customer base is a mix of critical access hospitals in very rural areas, as well as these large receiving level one trauma centers in urban areas. And for each of them, there's been different issues. When you think about resources with the rural hospitals, a lot of these folks are in areas where they might have one ground truck for an entire county, and if that truck leaves for 4 hours to take a patient somewhere, they don't have coverage during that time. And there's a lot of anecdotal evidence, a lot of stories that are shared that hey, we don't have enough coverage, but there's not a lot of hard data to really show the need and what's happening from a resource utilization standpoint. And that was just exacerbated by COVID-19. Obviously, there were a lot of patients that needed to be transported, and so those issues were highlighted tremendously. At the same time, these larger facilities had uh, you know a plethora of patients wanting the other facilities wanted to transport to them, but they didn't have beds available for a number of different reasons, whether it was nursing shortages or a number of other factors. But there were patients that we could have moved down the system, so from a level one trauma center maybe down to a community hospital. But part of the challenge there is just coordinating transport. There's reimbursement challenges with that. So I think it's really highlighted some core issues with how patients move around through the system, and we're trying to be in the middle of all of that, to be the solution, as opposed to just kind of sitting back and letting things happen. So we worked with our core customer base in Kansas on creative solutions to try to move patients down the chain to open up beds um, for those very sick patients. We're talking stroke patients, people who are having heart attacks and the like. Um, in addition, just providing that, like I said, that resource allocation for those small critical access hospitals so they can really understand what's happening uh, with respect to patient transport and the types of resources that they need.
Well, I really appreciate you going through more of this this problem that was highlighted by COVID. Obviously, it was there before, but I think the spotlight got shined on it a little bit more as a result. And then, I just want to make sure too, like if there's anything, I know you talked a little bit about it, like Motion's role, but if there's anything we missed or that you want to add about how Motion's helping in that movement, please add it. But appreciate your comments on all these questions today.
Yeah, absolutely. I think again, at its core, we really feel like there's power in understanding how patients are moving throughout a system. We were able to provide to the state of Kansas, who is our main customer, really robust data to help them to understand trends that we were seeing in patient movement, trends we were seeing in bed availability, and things that really help them to make decisions about what to do to help alleviate some of the stress on the system. And as we move kind of out of the pandemic, hopefully, we really feel like there's still tremendous value in understanding how those patients are moving within a system. We had one of our initial customers was an accountable care organization that as we started to work with them, they discovered that 50% of their patients at one point in time were being transferred 2 to 3 times before they got to um, the right destination, the right care setting. So we want to help avoid things like that. We want to highlight, like I said, places where there are much needed resources, both from a ground ambulance standpoint as well as an air standpoint, and we want to make sure that you know everybody has a solid understanding of how those patients are moving and how we can potentially uh, make sure that they're ending up in the right place. Um, there's things we can do with these critical access hospitals around sustainability for themselves. Understanding the types of patients they're moving out can help them understand, if they can expand service lines or maybe find ways to be more, financially sustainable themselves. So there's a number of different things that we do that we really feel like just having that understanding of what's happening can really highlight and really bring tremendous value to our hospital customers.
I want to thank you for your time here today and answering our questions. Really appreciate it. Uh, Hopefully, we can have you come back on in the future. We can dive into some other issues, but this was really your intro episode to kind of highlight the company too, to let people know that maybe haven't heard of you yet, and then people that have heard of you, they get that extra dose of kind of hearing you on answer some core questions and give us kind of how Motion's playing a role in this space. So thank you so much for your time. I really appreciate having you on the podcast here today.
Yeah, great. Thanks, Jared.